Hello everyone. In this particular session of the pharmacology, I'll be discussing this very important group of drugs, that is the coagulants. So we have an endogenous coagulant in our body, that is vitamin K. So the main coagulant in the body is vitamin K. Right, so this is considered as endogenous coagulant. Right, this is considered as the endogenous coagulant. So the main coagulant in the body is vitamin K, and this vitamin K, it is in three forms. Right, it is of three types. Now what are these three types? We have K1, K2 and as well as K3. Right, K1, K2 and as well as K3. So you take this K1, K1 is phytonadione. Whereas if you see this K2, it is minaquinone. Right, it is minaquinone. Whereas K3, it is minadione. Right, K3 it is minadione. So we have K1 phytonadione, K2 minaquinone, K3 that is minadione. Now why is this vitamin K called as the coagulant? Because vitamin K is involved in the activation of various clotting factors. Right, this particular vitamin K, it is required for activation of various activation of the various clotting factors. And what are those clotting factors which are activated by this vitamin K? That includes 2, 7, 9 and 10. You take this factor number 2. Factor number 2, it is prothrombin. Right, so for activation of factor number 2, we require vitamin K. And it is also required for activation of factor number 7. So this factor number 7, it is the stable factor. Right, factor number 9, it is the Christmas factor, and factor number 10 is the Stewart-Prover factor. Okay, so these are the various clotting factors which are activated by the vitamin K. Now in what way this vitamin K does the activation of this 2, 7, 9, 10? This vitamin K, it carries out the final step in activation of these factors. Right, this vitamin K, this vitamin K, it carries out final step in activation of these factors. Now what is that particular final step? That particular final step is gamma carboxylation of glutamate residues. Right, gamma carboxylation of right, gamma carboxylation of the glutamate residues. Now, where is this particular vitamin K indicated? The main indication of using vitamin K are deficiency states, right? So, right, main indications include the deficiency states like dietary deficiency, or the deficiency could be due to prolonged antibiotic therapy or the liver disease. Okay, so deficiency states like dietary deficiency, number 2, prolonged antibiotic therapy, right, and third important scenario is in the liver disease. So these are the scenarios like where you need to give the vitamin K supplementation. Now apart from that, you take the newborn babies. Newborn babies also we give this vitamin K because usually they have deficiency of this vitamin, right? So another indication of this vitamin K is in the newborns, because newborns, they have or they are deficient of this particular vitamin. And apart from that, we have a very important vitamin K antagonist which is acting as the oral anticoagulant. And what is that particular oral anticoagulant which is acting as the vitamin K antagonist? That is warfarin. So in case of this warfarin overdose, right, warfarin is a vitamin K antagonist. So in case of the warfarin overdose, we give this particular vitamin K, right? So for most of these indications, the vitamin K1 is used, right? For most of these indications, vitamin K1 is used, and this particular vitamin K1 is phytonadione, right? It is your phytonadione. Now let me tell you some of the important points related to these various formulations. But anyways, let me just have a short recap of these coagulants. Coagulants, the main endogenous coagulant in the body is vitamin K. It is of three types. We have K1, K2, K3. K1 is your phytonadione, K2 is your minaquinone, K3 is minadione. Vitamin K, it is involved in activation of various clotting factors, that is 2, 7, 9 and as well as 10. Factor 2 is prothrombin, factor 7 is stable factor, 9 is Christmas factor and 10 is the Stewart-Prover factor. Now this vitamin K is not only required in the activation of various clotting factors, it is also required for the activation of anti-clotting proteins, right? They are also required for the activation of the anti-clotting proteins. So it carries out, right, what is the mechanism by which it will cause the activation? It carries out the final step in the activation of these factors, that is gamma carboxylation of the glutamate residues. So this is the final step in the activation of these factors. And main indications of using vitamin K are deficiency states like dietary deficiency, prolonged antimicrobial therapy and liver diseases. And not only that, this vitamin K is also given in the newborn because usually they have deficiency of this vitamin, and this vitamin K is also given in the overdose of the oral anticoagulants like warfarin. And for most of these indications, vitamin K1 is used, that is your phytonadione. Now let me tell you some of the important points related to your formulations. So for most of these indications, we use the K1 form of your vitamin K, which is nothing but your phytonadione. Whereas you take this K3 form, right? And what is this particular K3? K3 is minadione. This K3 form, it is contraindicated, right? Why? K3 form is contraindicated in patients with particularly G6PD deficiency patients, right? So minadione, it is contraindicated in, right, it is contraindicated in G6PD deficiency patients, right? And why is it contraindicated in G6PD deficiency patients? Because it will cause hemolysis, right? Because it will cause hemolysis. And in newborn, it is not only contraindicated in G6PD deficiency patients, this Phytonadione, it is also contraindicated in the newborn. Now, why is it contraindicated even in the newborn? In newborn, this Phytonadione is associated with more chances of kernicterus. Right, it is associated with more chances of kernicterus. Now, first of all, you need to understand what is kernicterus. Kernicterus, it is a type of brain damage that can result from high levels of bilirubin in the baby's blood. Right, so kernicterus, it is a brain damage. Right, and why is this particular brain damage? This particular brain damage, it results from high levels of bilirubin, right, high levels of bilirubin in the blood of the baby. Now, this bilirubin which is increased in the baby's blood, it will cross the blood-brain barrier, it will go and get deposited within the brain, right? This bilirubin will go and get deposited within the brain. And once this bilirubin gets deposited within the brain, this will cause athetoid cerebral palsy. Right, this will cause athetoid cerebral palsy and hearing loss. Right, this will cause athetoid cerebral palsy and hearing loss. This kernicterus also causes problems with the vision and teeth, and sometimes it even can cause intellectual disabilities. Okay, so in this patients with the kernicterus, there can be problem in the vision and as well as the teeth, right? Problem in the vision and as well as teeth, and sometimes it can cause even the intellectual disabilities. So this Phytonadione, that is K3, is also contraindicated in newborn. Why? Because there is more chance of kernicterus, and you need to know why there is kernicterus. That is why there is increase in the bilirubin levels. That is due to competitive inhibition of glucuronidation of the bilirubin. Okay. So this bilirubin in the liver, it has to undergo the process of glucuronidation. Right, it has to undergo the process of the glucuronidation. Now, what this Phytonadione will do? Phytonadione will cause Phytonadione will cause competitive inhibition of glucuronidation of bilirubin and its displacement from plasma protein binding sites. So this is about your coagulant formulations K1 and K3. So in many of the indications, wherever you require vitamin K, we give the K1 form, which is Phytonadione. And if you take this K3 Phytonadione, it is contraindicated in patients with G6PD deficiency, and it is also contraindicated in the newborn babies. Now, it is contraindicated in G6PD deficiency because it will cause the hemolysis. It is contraindicated in newborn because more chances of kernicterus due to competitive inhibition of glucuronidation of bilirubin and its displacement from plasma protein binding sites. And this Phytonadione is associated with the development of kernicterus. Kernicterus, it is a type of brain damage that results from high levels of bilirubin in the baby's blood, and it will cause athetoid cerebral palsy. That is, in kernicterus you will have athetoid cerebral palsy and hearing loss. And kernicterus also causes problems with the vision and teeth, and sometimes can cause the intellectual disabilities, right? So these are some of the very important points related to your coagulants.